Good afternoon. I'm here with Humboldt County Health Officer Dr. Teresa Frankovich for the Monday, June 8th media availability. Thank you for being here.
Hi, thank you.
Before we get started, can you talk a little bit about the surveillance testing that public health has been doing at local skilled nursing facilities?
Sure. So again, our skilled nursing facilities, our congregate living facilities like assisted living, have some of our most vulnerable residents. Skilled nursing facilities actually have a directive from the state about surveillance testing, and we've been working with them on accomplishing that. So we've just completed another round of surveillance testing for staff, and all ran those this weekend, and everything was negative, which is great. We're also working with the many assisted living facilities to try and help them access ongoing surveillance testing as well for their staff and plan for that as just an additional safety measure going forward.
Excellent. I'm going to launch into the questions.
Okay.
On Friday, you mentioned there are still concerns about the possible impacts of the recent protest gatherings. If the case count increases, will businesses that have been certified to reopen, like salons, be asked to close down again for safety? And can you also talk about whether stylists need to be wearing gloves?
Sure. So yes, of course, we're monitoring for case counts, and we do that ongoing. If the case count increases, I don't expect us to be closing anything right now. I think basically what we'd be looking for are ongoing indicators to suggest that we're heading down a path of too many cases. So simply seeing an increase over our baseline is not enough for us to close anything, frankly. We expect to see an increase in cases as we move forward. What we're looking for are kind of the rate of increase, the trends over short periods of time, our hospital capacity, and our contact tracing abilities. All of those things will inform whether we need to take a pause in opening additional new things, which would be our first strategy, and then also whether there's actually ever a need to step back and close things that we've already opened. So I don't see that related to this at present. In terms of gloves, the guidance provided by the state, and anyone can pull up the guidance online if they want to take a look at what the business they're visiting is using as a template. The gloves are in the guidance are referred to as a possible way using disposable gloves to be able to address issues of frequent hand washing and things like that. So adding on those disposable gloves can help to sort of extend that and decrease the need for as frequent, but it really can't replace hand washing as a strategy for this. So there is no requirement to use gloves, except if you're doing some of the things that salons normally wear gloves for instance, for coloring and that type of thing, then those gloves would be used.
Excellent. On Friday, you also mentioned that campgrounds, hotels, and gyms are next to reopen in Humboldt. When do you anticipate nail salons will be allowed to reopen? And can you please explain the reopening criteria difference between nail and hair salons?
Sure. So first of all, the governor released a whole bunch of things on Friday, and the questioner is correct. Campgrounds, hotels, gyms, day camps, childcare, all bars, wineries, all kinds of things are on that list. So what we're doing is we're taking those guidances, we're reviewing all of those from the state. Some of them actually may need a little bit of additional information for our local area, and then we're basically putting those in order, trying to again emphasize that lower to higher risk as we move forward, and then we'll plan those time frames accordingly. So in terms of nail salons, I know that the thought process in this from the state's end going forward, and the reason it was initially, I think, further down the list in openings, is because there isn't any way to completely social distance throughout the interaction. And it tended many times to be a longer interaction than, for instance, most people's haircuts. However, I do think that nail salons can open. The problem we have right now is we're just awaiting the state guidance for it. As soon as the state provides that guidance document, so for what is needed to do that safely, and again, that guidance is produced by Cal OSHA with input from the state health department as well as industry. When that is available, we'll be more than happy to review plans and get those open as well. I don't anticipate a delay in that. We just don't have it in hand.
You mentioned childcare and day camps as being on the
Mhm.
most recent guidance, but
Mhm.
I know that some of those have already been on the guidance provided.
Sure, and the state initially provided guidance on childcare. In many respects, I actually liked that initial guidance better. It was, I think, a little bit more specific. And we actually have had some day camps that we have been able to approve because they operated under that childcare guidance. And so going forward again, we'll be sort of taking this state guidance and probably amending it a little bit because I think there were some really good points in that initial guidance that came out. So I know it's a little bit confusing, and the entities that are already operating under the other guidance, that's fine. But for newer entities that will be coming on board, we just want to make sure that the guidance looks appropriate for our area.
Thank you.
Mm-hmm.
Many services such as hair salons and hotels for tourism are scheduled to reopen this week. Can you share an overview?
So I think we walked through that a bit, but again, I just want to point out that the earliest any of the things that the governor put on the list, the earliest that those could open would be June 12th, which is Friday, right? So we have hair salons are already approved to be open. My hope is that we will have campgrounds ready this week in terms of having the guidance up online and having people be able to submit their plans. Hotels are an entity that will follow. So I don't have a precise opening date for that yet for recreational travel. Obviously, some hotels are operating right now for essential travel.
And then the final question, what businesses and services will remain closed?
So the things that have been historically more further out, I guess, in sector 3 or stage 3, included things that are really mass gatherings. And that's really the big, so, concert venues, sporting events with spectators, those kinds of things are meant to be further down. And again, I know sometimes it seems a bit, inconsistent, the guidances, some of the things that are coming out that involve larger groups of people coming into those same space. And so we look at that and go, well, then why can't these other mass gatherings occur right now? But I think it's important to remember that the guidance that's out right now for things, for instance, like restaurants, includes a lot of social distancing. The intent of it is people going out with family members. We're not encouraging people to come into large spaces and interact with everyone in the space, which happens when we're together in, for instance, bars, or we're together in concert venues or things like that, where we definitely have less of an ability to social distance. And so those things are meant to come a bit later, whereas these things that are more carefully structured for distancing and such are able to happen a little bit sooner.
Excellent. Thank you so much.
Thank you.